anxiety scale for children, the NASC, a broad anxiety scale for ages 8 to 18, and they basically self-report. Social phobia, and I certainly don't expect you to know the names of all of these, but I'm just telling you there are resources. The Leibowitz scale, social anxiety scale for children and adolescents, is one that I'm the most familiar with. Treatment, cognitive behavioral therapy, group therapy, family therapy, and you can use an SSRI as a first-line treatment, but you generally start at a half the recommended dose for SAD. Okay, now we're getting into some of the more anger issues, disruptive behavior disorders. The first one I want to talk about is oppositional defiant disorder, and it's characterized by a pattern of negativism, hostility, and defiant behavior. Okay? So the kid that's 12 years old that knows his curfew is at 9 but just doesn't come home till midnight and doesn't really give a rip, you know, that can be a symptom of ODD. ADHD and ODD and CD, which is conduct disorder, have been found to co-occur in 30 to 50% of cases in both epidemiological and clinical samples. And I think Dr. Latassi had about that same statistic, that it's often has a comorbidity. Pardon me. Conduct disorder is more severe than ODD, but it is less common, thankfully. Disorder of habitual rule breaking defined by a pattern of aggression, destruction, lying, stealing, or truancy. So what does this kid look like? The kid that you kind of, you know, think, oh, there goes a future convict. So it's sad, but it's true, you know. So while conduct disorder is a strong predictor of substance abuse, ODD without conduct disorder is not necessarily. I said that at the bottom of the other one, didn't I? Oh, well, I said it again. Okay, so I said it twice. But, you know, a lot of times ODD, ADHD and conduct disorder and the substance abuse, I mean, what's that all about? Are they? I think they're trying to self-medicate. You know, a lot of times that's where you see the substance abuse with conduct disorder. 4 main categories of conduct disorder. There's an aggression towards people and animals. There's a category of destruction of property without aggression towards people or animals. So these are just the vandals or the fire starters. There's a deceitfulness aspect to conduct disorder, deceitfulness, lying, and theft, and then serious violations of rules, and that could be anything. I mean, rules of the household, rules of the community, rules of the state. Okay? So to diagnose a kid with conduct disorder, you need 3 from one or more of the 4 categories in the past 12 months, and with one in at least the last 6 months. Okay, so this isn't something, I can't go now diagnose my husband with conduct disorder when he was a teenager. Although, probably more ODD, but you know how it goes. Okay, aggression to people and animals. Bullies, threatens, or intimidates others, initiates fights, physical fights, has a weapon that can be used to cause serious harm to others, a brick, broken bottle, knife, or a gun, physically cruel to people, physically cruel to animals, stolen while confronting a victim, like mugging or purse snatching, not just thievery, okay? And force someone to sexual activity. Conduct disorders, 3 from one or more of the 4 categories, and these are the 4 categories, you understand. Aggression towards people or animals is one category, then destruction of property is another category, deceitfulness or theft is another category, and the serious rule violation stays out at night. So 3 from one or more of the 4 categories in the past 6 months, with one of those, or in the past 12 months, pardon me, with one of those occurring in the last 6 months. So basically, there's how you qualify within those categories. Anybody have any questions about that? Okay. Pardon me. So that they consider the serious violations of rules: run away from home, overnight at least twice while living in the parental or parental surrogate home. What would be a parental surrogate home? Foster care, living with the aunt because the parents can't control that child anymore. Okay. And didn't come home for a while. Truant from school beginning before age 13. Yeah, that's a pretty serious clue if they're already playing hooky in 4th grade. All right. Treatment: cognitive behavioral therapy, family therapy, parenting, education, and carbamazepine maybe. I don't know. There's not a lot of good treatment for that. Intervention before it gets to that point is what you're hopefully going to find best. Okay, any questions about the angry disorders, ODD and conduct disorder? Nope? Okay. Suicide. Suicide is the 3rd leading cause of death for adolescents and emerging young adults ages 10 to 26, whereas it is the 10th overall cause of death for Americans. To me, I find that statistic absolutely horrifying. Adolescent mortality from suicide tripled between the 1950s and the 1990s and has remained overall stable since, maybe declining a bit in the 90s and then rising again over the past decade. Females attempt suicide at a rate of 2 to 4 times that of males, are most likely to attempt suicide by ingestion. Males are more likely to commit suicide by violence, gun death. Females don't want to mess up their face, so that's why they're more likely to ingestion. They don't want the thought of the... Did you guys do the suicide interventional thing? What was the name of that? What? Yeah, I was trying to remember that. I went and did that. That's my suicide sticker on my door. I did the SBIRT training, and it was really, I thought it was really pretty awesome. I went and did it on campus, and there was just a bunch of us faculty, and like there was some of the housekeeping staff was in there, some of the facilities guys were in there, and I just thought it was, I just looked around that room and I thought, okay, I'm here because I'm a PA. That facilities guy is here just because he cares about these college kids that he works with on campus every day. I thought that was a really cool thing. And I was really pleased that you got that SBIRT training. Please remember, when I start teaching you about typhon, please remember that's something that you want to maintain and you want to list on your typhon as part of your credentialing. Okay? Completed suicide rates are highest in non-Hispanic whites, accounting for about 13.9 out of 100,000 attempts. Native Americans, 10.6 out of 100,000 adolescents. Suicide rate for black males, 10 to 19 years old, doubled between 1980 and 1995. And this is the one that just hits my heart. Gay, lesbian, bisexual, transgender, and questioning youth report significantly higher rates of suicide thoughts and attempts than their heterosexual peers. More than half of all deaths by suicide in the United States involve a firearm. You know my Mama Bear t-shirt that I wear sometimes? You guys have all seen that? You've seen that, my little rainbow cup? Rainbow Mama, or my Mama Bear with the rainbow cup. Every time I wear that in public, there will be some adolescent that will come up to me and talk to me about my t-shirt. And I just say, oh my gosh, I wish my mom would wear a t-shirt like that. Or, oh my gosh, my mom would love that shirt. Where did you get it? Well, Amazon. Where's anybody get anything? Seriously, and I stood in Target and talked to a kid for 25 minutes about how to, this was a 14-year-old gender non-conforming child, how to come out to their parents and talk to their parents about gender non-tradition. And it is such a difficult discussion to have. So we talked, I gave my phone number, I've never heard back from the kid, I took that as a good sign. But, it was just, every time I wear that shirt, somebody says something to me. No one's ever said anything negative about it, at least that I didn't hear. Okay, so suicide annually in the United States, 2,000 adolescents die from suicide and over 1 million suicide attempts come to medical attention. There are as many as 11 times the number of attempts as completed suicide. Now what was it you called it in Esbjerg? Does anybody remember? What? Completed, yeah, completed. Yeah, and it wasn't attempted suicide, it was...
They just didn't want us to say successful.
Yeah. Yeah. So, I remember, I wanted to go, I was in the middle of trying to change all these when Dr. Griffin started. So I'll update this for next year, and it'll be more Esbjerg language friendly. Overall suicide accounted for 10.9, I already said that. But look at this, ages 15 to 24 in 2011. Ages 15 to 24. You know, part of this is because at some point, adolescents don't realize the finality. You know what I mean? They don't have that concept of finality. But still, I mean, if you could just ask a question and maybe thwart somebody's mode of thinking. In 2013, 17% of youth surveyed in grades 9 to 12 reported feeling seriously considering suicide at some point in the preceding year. With greater than 8% report attempting suicide in the previous year. What are some of the risk factors? Well, a history of a previous suicide attempt would be a great risk factor for another. Social isolation, substance or alcohol abuse. Family history of suicide is a huge thing, huge. Family history of severe mental illness or substance abuse. Past or present sexual or physical abuse. Family conflict or disruption. Presence of firearms in the home. One of our routine questionnaires for every well child check looks at child safety. And there was a question, do you have firearms in the home? And this one guy one time, he wanted to go toe-to-toe over his Second Amendment right to not answer that question. I just said, look, I simply care because if there's a firearm in the home, there's a higher risk of suicide in your home. And once he understood why I was asking, not that I was going to report it to some government agency, then he understood. So sometimes, you know, people, the general public and the parents don't understand why we care about so many things that, as far as they're concerned, don't affect the health of their child. Okay? Physical examine skin for signs of physical abuse. Although a lot of times self-mutilation is a completely, entirely different thing. A lot of times self-mutilation, the psyche behind that isn't about suicide. It's more about they feel so numb that they feel like they have to feel something. You know what I mean? Prognosis, 20 to 50% of those attempting suicide will try again. Multiple reports show that a majority of adolescents who attempt suicide disengage with treatment after a few visits due to a multitude of systemic and societal factors. So they might go to a few treatments, but then they disengage. And when they do that disengage, they're at an even more incredibly increased risk for suicide. I've had packs with kids. You know, and I give them my cell phone number. I give them, you know, anything I can. Call somebody, call me. Any questions about any of that? I know you've studied that before. It's just something that we need to be aware of because while on the one hand suicide might be the absolute most selfish thing a person could ever do, on the other hand, where they're in that spot, they can't see anything past it, you know, so. All right, Munchausen Syndrome by proxy. Anybody heard of this? Everybody knows what this is? This is where a caregiver is essentially seeking attention by inflicting either factitious or either making stuff up about their kid, but most of the time Munchausen, they're actually doing stuff to their kid to cause them to have to seek medical attention. okay? When I was growing up, you guys, we didn't have cable, we didn't have VCRs, we didn't have any of that stuff, so I think I told you this, I had a twin sister with a disability, right? She was in a wheelchair. She had SMA type 1, spinal muscle atrophy type 1, also known as Wernicke-Hoffman's. She had a life expectancy of about 2, but lived to be 13 because my mom was an awesome caregiver, okay? So, Sunday morning, me and Becky got the newspaper, got the TV guide out, and we would go through, in the back of the thing, they had all the movies, and they described all the movies in the back of the thing. And for some reason, there was this whole trend of Munchausen by proxy movies that were like ABC's Movie of the Week and stuff like that. We'd circle all of those. I just remember, you know, when I was a kid watching the Marcus Welby type doctor that, you know, that they would sneak in and hide the video, you know, hide the camera, or, you know, put the one-way little peephole in the wall of the infant's hospital room so that somebody could look from the other side and see the mom go over there and smear poop on the kid's IV side or something like that. Anyway, that's neither here nor there. So Munchausen, it just, you know, it results in harm to the child victim through repeated interactions with the medical care system, unnecessary tests. You know, every test has a risk. Every lab draw has a risk. The kids are on medications they don't need. Unfortunately, sometimes they'll even have surgeries they don't need. It's got many different names. I didn't do any research onto the word Munchausen, so if anybody wants to email me that, I will think highly of you for many years. All refer to harm that befalls children through the actions of a caregiver. Symptoms decrease when the child is separated from the perpetrator. That's not rocket science. Okay, it's very rare, no typical presentation. Most victims are less than 4 years of age because they're not old enough to tell anybody what mom's doing. Males and females are equally represented, although it's predominantly a mother that does this. Morbidity is significant. Cases can be fatal, especially those involving surreptitious administration of medications, poisoning, or inducing apnea. Okay, does anybody watch Ozark?
Yes.
Okay, what did she grind? Okay, spoiler alert, I'm talking about the season finale of 2. So if you haven't seen it, just go, la 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 la. What did she grind up
I don't know.
and give her husband?
Oh, it was. I can tell you after.
Okay, yeah, tell me after, because I was thinking, what?
Yeah.
Because it was something really common, and I was just like, oh my gosh. Okay, we're done. Okay, all right.
I'm not there yet.
That can't be cray-cray. She's just flat crazy, too,
Yeah.
by the way.
The wife?
Yeah.
Okay. I really liked it when they gave a little bit of backstory on the two of them. That was
It's
kind of
called
cool.
Ozark.
It took me a minute to figure out what
Have
it
you
was.
seen it? Heard of it?
Okay, so
Okay.
red flags. When do you think Munchausen syndrome by proxy? Not when the parent comes in and says, I swear to God, their fever was 103 at 4 a.m., even though it's only 99.2 in your office. That's not it. But if they move frequently, siblings who have either died or had unusual medical illnesses, and they tell you seeking care at a variety of facilities, they don't. Go ahead.
Oh, you can finish this. I just have a...
Okay, reluctance to accept less severe diagnosis, okay? I never have understood people who want their kids to be sick. I've never understood that. You know, they come in and they know they need an antibiotic, they need lab work. No, really, they need fluids, some Tylenol or Motrin in 72 hours, I promise. You know. Okay, Kristen?
Have you seen, it's kind of been like all over Facebook in the last few months, the girl who killed her mom because her mom told everybody that she like couldn't walk. They were in her
That happened in Springfield.
Springfield, Missouri?
Yeah, they were in
Yeah.
Hurricane Katrina. They moved to Springfield.
Yeah.
They built
They got a habitat for
a
community
house.
Yeah.
And the kid could walk?
Yeah.
Yeah,
She
well,
was totally fine. She didn't have
yeah.
cancer. The mom was like poisoning her.
This is crazy.
And then she got an online boyfriend from Wisconsin, and he drove down to Springfield and murdered the mom. Stabbed her.
well, and then she told the girl.
This is like a catfish.
This happened like recently too.
Yeah, and she was like 19, 20.
Yeah.
So when she figured out when she was like 8 that she could walk, and she was talking to her mom was like, well, if you tell everybody now, they're going to take this stuff away from us. And
There's a
yeah.
documentary on It's on HBO. It's called Mommy, Dead, and Dearest.
Really?
That's
So
like
interesting.
I told her that she had like cancer, she got chemo, they
Yeah.
shaved her.
Like
That's
she was,
crazy.
she lost all her teeth. Like it was bad.
Yeah.
That's crazy.
Yeah. And then the boyfriend came down.
Okay, now my next question has to be, did you do this, did you find this before PA school or during PA?
I did because it happened in my hometown, so
Okay.
it was like on the news. So
Yeah.
I knew about it. But
It was during. It was like
during.
last month.
yeah, definitely, I recommend the documentary. It's interesting.
I've told you guys my West Wing story, right? West Wing, anybody seen West Wing? Martin Sheen, right? Yeah. No, nobody knows what that is? Okay. After PA school, start West Wing. It's on, what's it on? Netflix. It's amazing. It's this political, Martin Sheen's the president. You just want to go have a beer with Toby and CJ and, seriously, what West Wing is this political show. It's an amazing drama. I think I episoded it in all 8 seasons in about 3 months. But it started when I was in PA school. I never even heard about it. There's a whole bunch of stuff. I didn't even know who was president when I was in PA school. And I'm pretty political if you haven't picked up on that. Okay, let's move on. So, diagnostic procedures. Workup is dictated by the presenting complaint. You're going to do an EEG for seizures, cardiac monitors for syncope. Toxicology screening can be helpful for unusual presentations of poisoning. Special care must be taken to prevent the caregiver from tampering with the diagnostic testing. Okay, so you want to try to separate the caregiver. And this down here, this is what made me think of the ABC movie of the week. Covert video monitoring of a patient's room may demonstrate the perpetrator harming the child. That is so easy to do these days. Those, what are they like? Well, not the Ring doorbell, because that's outside your house, but they've got all these nanny cams and stuff. Yeah, so. All right. Boy, I'm glad we didn't have those when my kids were with the babysitter. I'm just glad I didn't see what happened, what went on. All right, treatment. Effective care requires that medical providers work closely with other professionals in the community, both to gather information and to ensure the patient's eventual safety. Child protective services have to be involved. Mental health services, law enforcement, all have a role to play. It's got to be a multidisciplinary approach to this. Interventions, a variety of interventions may be appropriate depending on the severity of the symptoms, from counseling to foster care to criminal prosecution. Okay? Any questions? All right. So, in case I haven't showed you this is my husband Paul. Notice his t-shirt. This was September 14th, the day after his brain surgery. He was discharged straight from the ICU to home. And that is Jackson _ the softest dog ever. I know I've talked to you guys about Venus. I told you about Venus. I told you what happened to Venus. Attacked my son's dog. We had to have her put down. Yeah, it was really, really tragic. And we were without a dog. We never knew, because we had so many kids, we never knew that we were going to be dog people when we got to be old. Because we were never dog people before. We were kid people. In fact, we had the lady that, if you want to take a break, you can. I'm just going to tell a story for a few minutes and then start urology. But we had the lady that, when we lived in Connecticut, we lived in Meriden, Connecticut, on this